Okay, so this is our Trach Cares video. So anyway, we're going to do the same type things as we've done in the past. We're going to, check our patients, our doctor's orders, as to how often they want this done. We're going to gather our equipment. I've got my tracheostomy kit, I've got NS, I've got hydrogen peroxide, and I've got a pair of scissors here. So I'm going to ID my patient, and again, like I said, a patient with the trach is not going to be able to talk. So again, I'm going to say your Kit Kat, your birthday's 9/29/85, and they're going to shake their head yes or no, whether this is the case. So anyway, so ID them properly. I'm going to explain the procedure to them. I'm here. We're going to clean your inner cannula. We're going to change your dressing and get you all cleaned up. So anyway, provide that privacy, close the door, pull the drapes, whatever needs to be done. I'm then going to clean my hands. And again, position the patient semi-Fowler's to a high Fowler's position. Okay, so I've got my kit here. Just tell me to open it this way. So again, opening it away from me. Again, I'm going to slide these over here. I want to grab this drape out of the top right here. Maybe. Fold it back where I can grab it. Okay, so grab this, step back. This is again a waterproof drape. So I'm going to open it, shiny side down. And again, I'm going to place it here on my table. So this is now my sterile drape. I'm going to take my supplies and I'm going to just dump them again from the side here. I'm going to kind of toss them onto my sterile field. So the container the box has 3 different compartments, and so we are going to put different solutions in each of these containers. So like I said, I'm going to get my NS and I'm going to pour it into one of the little compartments. And again, I should have lipped this beforehand. Well, this was actually new when I opened it, so I didn't need to lip it. If it had been a used one, I'd want to lip this and pour some into the garbage can. New one, again, like I said, I'm going to label and date it when it was opened. So I'm going to pour some of that into one of the smaller containers and also into the bigger container, the bigger compartment. And then again, with my hydrogen peroxide here, I'm going to pour about half full into this, the remaining container. And again, you want to remember which one is which. So my left one has my hydrogen peroxide on it. So anyway, so I want to put on a pair of clean gloves. And I'm going to come here and I'm going to stabilize this face plate. Whenever we're doing anything, even though it has the ties on and it's secure, we want to make sure that we're stabilizing this face plate. And I really don't want to go over their face, but you kind of have to stabilize that face plate. And I'm going to remove the inner cannula. And some of them you have to kind of twist to pull out, but this one just kind of pulled out on its own. And so anyway, this is the inner cannula. So I'm going to remove this, like I said, and I'm going to put it in the container with the hydrogen peroxide. And then I'm going to come back over here and I'm going to remove the dressing that's on the trach. So I'm going to just kind of carefully pull and remove it. So I want to look at this dressing and I want to, look at what type of drainage there is on this dressing. I want to look at the taco, again using our little acronym taco, the type, the amount, the color, and odor of any drainage that may be here on our dressing that we just removed from that patient. So anyway, so once I've looked at that and documented that, again I'm going to encase this in my glove, and again double gloving this and discarding and throwing this away. Biohazard bag probably would be best. But anyway, so at this point I'm going to come over here and find my sterile gloves. And again, they just kind of flipped out here onto this package. And again, maybe grasping them again by those cuffs. So again, I'm going to come here and I'm going to find my right glove and put it on. And then come up underneath the cuff and put on my left glove. It needs to be flipped around. Oops, maybe not. There, so I've got my sterile gloves on. And at this point I can come here and then I can sort out my equipment that I've got here. So I've got a new dressing, and trach dressings always have this slit in them. You don't want to cut a dressing because if you were to cut it, that could the patient could inhale all the little fibers. So we want to make sure that we aren't cutting it. We're getting ones that are already pre-cut. There's my ties. I've got some 4x4 gauze here. I've got a brush. I've got some Q-tips. And I also have some pipe cleaners. So I'm going to kind of lay these out right here and in the order that I'm going to use them. So anyway, I'm going to clean this inner cannula. And so again, I'm going to, with both hands here, I'm going to, with the brush and the pipe cleaners, I'm going to clean this inner cannula. So again, kind of holding it on to the inner cannula. With this brush, I can push it through that inner cannula and clean it. Clean the outside of this with the brush. That dipped in there. And again, like I said, there's pipe cleaners again that we can insert through there to clean that really well. Dispose of those once we've used them. So anyway, so then I want to rinse this. So again, in my other little side compartment right here, I want to rinse this, rinse off the hydrogen peroxide that is on it. Make sure I've got it nice and rinsed. And then I want to tap it onto the side. And again, I'm holding onto this by the cuff of it. So again, kind of tap it off to get all that liquid out of it. And then again, I'm going to come over here, hold on to the face plate. And again, this hand now is not sterile because again, I'm coming and holding on to the face plate as I reinsert this inner cannula. And again, sometimes they twist, and this one just kind of presses in and locks. So again, like I said, at this point now, the sterile clean part of this is done. This hand is technically still sterile and this one is not, but from here on it's just kind of mainly maintaining the cleanliness. So we're going to clean the site. So we have these gauze pads here, again, that we can come over here and we can soak them in the big area of the NS. And again, kind of wring it out, and then again we're going to come over here and we can clean up underneath this face plate, and we're going to start at the stoma and again working around to make sure that we're cleaning because they can get kind of a lot of gunk and what have you around that stoma. I like using the pipe cleaners, the Q-tips, and again dip it in your NS, and again with this you can really get it under here and starting at that stoma going out, really clean around that area because they can get kind of a little crusted. Blood and drainage and what have you there. So anyway, we're just making sure that we're really cleaning that well around stoma site. And again, starting at the stoma and moving out. And again, my hand went below that sterile field, so that wasn't so great. But like I said, not really kind of sterile at this point. And again, assess that again for our taco, you know, looking for any drainage, you know, the type, the amount, the color, odor, is there any odor associated with it, as we assess that stoma site in and of itself. We can get one of our dry gauze, and we want to make sure that we're patting this area dry if we've got it really, really damp. You don't usually get it too damp, but again, we'd want to make sure that we dry it off from here. So from here, like I said, we want to apply our new dressing, and again, they're always going to have this slit in it. So anyway, it's going to fit underneath there, and with your finger you can kind of just press that up underneath that face plate. And again, you hate crossing over their face. You want to keep this tube that is the air to the cuff, you want to keep it out. So again, make sure that it's not getting tucked up underneath there. So again, making sure that this is up under there tight again around that stoma. So now we've got our clean dressing on. And then we need to change the ties. Like I said, again, our kit has come with a clean tie. We always are going to leave the old tie on. We don't want to take this off, because if our patient were to cough or something, that the whole tray could come out, and we don't want that. So we're going to leave the old tie on and put the new one on, and we're going to put the knot on the opposite side. So since the knot is on this side, I am going to, and I like doubling it over first like this, and inserting that through the slot in the plate, and then pulling both ends of the tie through my loop. You can tie it on one side and pull it around. Anyway, I've kind of liked to do it this way. But once you've got it on here, like it says, I'm going to make sure it's smooth on their back of their neck, and then pull it around. The paper says to come around to the other side of the patient, so you're not in front of this trach. Again, you kind of want to avoid them coughing on you, but for the sake of videotaping it, I'm going to stay on this side. So I'm now pulling one side through, and then I'm going to tie this in a square knot. And again, we need to make sure it's a square knot, so it's not going to come undone. And it needs to be fairly tight, and we need to only be able to fit 2 fingers underneath it. Any more than that, it's going to be too loose. So at this point, I can come with my scissors, and I can recut and remove the dressing that was on there at first. And again, make sure I'm cutting off the right one. Come on. There we go. Maybe. There we go. Got the old one out of there. So again, readjust my dressing there, and like it says, it needs to be that 2 finger width only underneath it. And again, we're going to put the knot on the opposite side of where it was to begin with, and we want to make sure the knot is on the side. We don't want to put it on the back where the patient would be laying on it, because again, that could be painful and harmful to their skin. So anyway, we make sure the knot is on the side. So anyway, so that's technically the trach care, and like it says, the sterile part is mainly with dealing with that inner cannula, getting it, once we get it cleaned and resorted back in, then that kind of changes to a clean procedure from there, while we're cleaning and putting on the new dressing and ties. But anyway, at this time, like I said, I'm going to gather up all of my supplies, discard them. this stuff probably would be left in their room if they're having this frequently, the NS and the hydrogen peroxide. So if it's in the bathroom or wherever it's being kept, it may just be left in there. But again, put our patient in a comfortable position, and then again, we're going to chart and document what we did. I had removed my gloves, washed my hands as I left the room, and like I said, and again, leaving the patient in that comfortable position. And again, that is Trach Cares, not as frightening and scary as some people think that it is. But